Hi, this is Carrie Forbes, and I wanted to do a really short video to show you how to use clinical key for nursing drug monographs. The first thing you need to do is go to Lapis Library, and I'm just Googling Lapis Library, fastest way to find the site. Clicking on to Lapis Library now. To find clinical key for nursing, simply click on the purple nursing cross. That's going to take you to the nursing resources and databases. Don't use this A to Z list. It searches every single database that the library subscribe to. Scroll down, click on clinical key for nursing. If that happens, if for whatever reason you get an error message when you click that, like I just did, I'm actually going to go back and click on clinical key, and let's see if we can get through here. Okay, that seems to work. So either one, you can use clinical key or clinical key for nursing. And you can either scroll down and choose drug monographs right under here, under the search box, or you can choose drug monographs. However, I really like to use the drop down menu because it's better if you're searching by name brand. All of the drugs are listed by generic. So, for instance, if I wanted to search for Advair, which of course, what many students may know is the trade name or brand name. So, if I click on Advair, you'll notice when I did limit that to the drug monograph section, it comes up under the generic name. On the right, you can see a column here that gives you sort of a really quick overview, which sometimes this is all you need. You might just want to look over at this menu and see if you are looking up side effects, if you're looking up contraindications or interactions, or if you just want general information about the medication itself under monograph. If you click through to the drug, it just widens that information and gives you more information. The references are at the very bottom. So if you went to the reference, it would take you directly to the articles used to help create this information within this drug encyclopedia. This information is coming from Gold Standard. That's where they're getting this information from. Right underneath the generic name is the trade name or the popular name that the medications often go by. You can see the monitoring parameters, the things that need to be tested while the patient is on these drugs, the contraindications, um, the drug interactions, and finally the adverse reactions, the side effects. So lots of great information here. You can also just do a general search on Advair. So if we were on the main clinical key page and you just wanted to search about, let's say, Advair, and you wanted to search for Advair and asthma, you could just do a general search like that, and it would search all of the databases within clinical key. So you would see different, like a clinical overview. This is very similar to what you would see in both micromedics and up to date, those types of databases. So you could click on these. It would give you just urgent information at the top, key points, and then different diagnostic things, goals that the physician might give, the drug therapy options for this particular, for asthma in adults, treatment options, comorbidities, monitoring again, and then your references at the bottom. So really good, easy to use. It's easy to use clinical or on the bedside. Great, great website. One other really quick site that I like to make sure that nursing instructors know about is called Medline Plus. And I really like this because this is a free site from the National Library of Medicine. It is evidence-based and peer-reviewed. So you would just Google Medline Plus. And as you can see, even if I spelled it wrong in the search, it will pull it up. What I really love about this is, for instance, we can search for Advair again. When we search for Advair, we get, again, more information. It again brings you to the generic name for this, But this is an everyday plain language, and this is so great for patient teaching. So you could share this website with your patients, and it would give them very similar information on the drug, just not quite as clinical. It's not going to have all of the monitoring, not all of the contraindications, that type of thing. That would be included in the more clinical site, in the clinical key site. However, it is a really great site to know. So again, we could search for asthma, and again, see, some basic information that again is written in very general, everyday language, good for everyone to understand. This is great for parents, great for, especially for older people. You could write this on a card, and this would be easy for them to look up even on their phone. The other great thing is that this site is fully available in Spanish as well. So you can share this with your Spanish speaking population. If you have any questions about clinical key for nursing, or using Medline Plus, just let me know. This is Carrie Forbes. My email address is forbesc@ecu.edu. Have a good day.